Welcome back. The start of the so-called flu season in April saw a steady increase in the number of hospitalizations. That's according to the National Institute for Communicable Diseases. So as we head to the end of winter, how are we faring and how can we improve our chances of staying healthy? Let's bring in Dr Mvuyisi Mzukwa. Is the chairperson of the South African Medical Association, and he joins us now this afternoon. Great to talk to you, Doc. Thanks very much for coming on. And I feel that there are very few of us who have escaped this flu season unscathed.
Good afternoon to you and to your viewers, Michelle. Thanks for inviting me. Yes, you are quite correct. There's very few of us. I think I had about 3 episodes already of flu, because, you know, with flu, you've got many of these strains going around. Okay, I was saying that that you've been exposed to one episode or one strain doesn't mean that you are immune to the other ones. Mm-hmm. So it's always important that we just protect ourselves, because we'll keep exposing ourselves, you know, because we meet people and everybody else who's infected.
Yeah, and I suppose the difficulty as well with the flu season, and perhaps this is true for previous seasons as well, is that it's not just influenza. There's also the aspect of whether what you have is actually swine flu, and I've heard a number of cases of confirmed swine flu, and of course COVID-19 is still with us.
Yes, Michelle, there's been many of these different viruses. Initially, during the early this year, we had a problem of RSV, you know, that was circulating, and then followed by our own flu season, which started around towards the end of April. And whilst we've always had our COVID-19, which was in its endemic phase. In other words, you know, it was always there, it never escaped us, but it has always been low at around 2% of cases. So, but also, like you said, there's always been swine flu coming in, but that has been causing hospitalizations, especially for those people with underlying medical conditions who never got an opportunity at times to even vaccinate themselves against flu.
Yeah, and you know, according to the pneumonia surveillance program, Dr Mzukwa, it's not just been cases of influenza, but also the detection rates. And of course, they're tracking different flu seasons going as far back as 2016. But for the same weeks, over a number of years, the detection rates had increased quite significantly. Is that correct?
Yes, that's correct, according to the reports. And that may be due to, you know, people being aware, but also, you know, as a clinician, especially if somebody is coming with severe symptoms, you want to know exactly what you're dealing with. So I think, you know, based on what we've been experiencing during COVID, you know, people are quick to say also, please test me for this or whatever the issue is. So it has increased, whether in terms of numbers, but also people are requesting to be tested as well.
Mm. And then, of course, you know, Doc, it's not something to be... I'm so sorry, excuse me. I myself am recovering from a bout of flu. But it's not something to be taken lightly, right? Influenza can be incredibly serious depending on comorbidities, and this was something that we come to know very well during COVID-19. But, you know, people who are pregnant, there are particular high-risk groups of people for which influenza can be incredibly serious and in some extreme cases, fatal.
Yes, you're very correct there, Michelle, because I think people have been worried about monkeypox and stuff like that, but they forget that simple flu is actually dangerous, especially if you've got underlying medical conditions, like you said. You know, but also we've got to protect ourselves, especially if you've got kidney disease, you've got diabetes, you've got cancer and all these things. So you do have to take a flu jab just to protect yourself during flu season. It's important also that when we go to the workplaces, we put on our mask if we have symptoms, because once you've got flu symptoms, you're coughing around, you're sneezing and stuff like that, so you are spreading the virus, and it's easy to spread to other people, and you might find the whole crew not available at work because they got infected by one person. So important that we also, wash our hands and everything else that we've been taught during the times of COVID.
And I wonder, whether we are still as militant as we are during COVID-19 when it comes to sanitizing our hands, right? Do you think, Doc, that the kind of mitigating measures that we had under COVID-19, masks, constant hand washing, sanitizers at various public spaces, that we've become lax, and perhaps that explains to some extent the kind of uptick we have seen in the likes of flu, pneumonia, and so on?
Yes, I think there's a psychological impact, because we've had to put on masks for a very long time. So there was that mask fatigue that captured us at some point. But I do think that we should have insisted, a special messaging from the Department of Health, that it's not only about COVID-19. It's also about, other viruses that we are circulating in the communities. So we should not stop this habit of, when we're having a symptoms, respiratory symptoms, we put on our mask and isolate ourselves in terms of, if you're working in a group with a group or in an open office, chances are that you are going to spread that virus to other people. So very important that you might take a day or two isolating yourself so that you attend to yourself, so protecting other people. But if you can't, you just have to put on a mask and do whatever you do, especially if you're going to places like the malls and using public transport and stuff like that. Very important. So what you've done is that you just, after COVID, you just stop everything. You just see now very few people putting on a mask when they have flu, which should be our habit by now.
Yeah, absolutely. And I'll go as far as to admit that I didn't wear a mask, Dr. Mzukwa, but that was because I was bedridden. And that's the state of the flu now, right? It's demanding that you stay in bed and that you rest your body.
Yes, exactly. Have lots of fluids, take your medication, but make sure that you also keep warm as well. Have enough in your stomach, just all those things. And even the medication that is prescribed by doctors, just important to follow the orders there.
Yeah.
Michelle.
Doc, just as a last question insofar as COVID-19 is concerned, do we have accurate numbers for, say, the last 6 months to a year or so? Or are people getting sick? Perhaps they are not even going to a GP and they're just self-medicating. But are people and doctors still testing for COVID-19, the likes of which we saw 18 months ago?
Well, what I'll tell you just now is that, the numbers, as we see from the NICD and also according to the surveillance network, they are very low numbers. But what has been happening is that, as a doctor, you want to test, but if the patient says, no, I don't think it's necessary and stuff like that, at times you're tempted to do that, especially if somebody has got severe symptoms. For those who have mild symptoms, not an issue as such. But, people are, to a certain extent, reluctant unless they have severe symptoms or recurring symptoms. So it is possible, because you must remember, COVID can also present with mild symptoms, very mild. So people it's possible that they are treating themselves at home and it disappears right there. So everything is possible.